The WWAY Health Fair is next Thursday. We will have a lot of vendors and information on hand at Independence Mall in Wilmington from 10 a.m. to 3 p.m. And as part of our run up to the fair, we met up with Dr. John Rommel from New Hanover Regional Medical Center to talk about congestive heart failure and what you can do at home to keep a healthy heart.
You know, I'm a cardiologist first and foremost, and then beyond that I have a subspecialty within that I specialize in advanced heart failure, which covers the terms of congestive heart failure. I also work with patients who are beyond standard medical therapy for heart failure. So I work with patients that have had transplants or being worked up for transplants, or have been worked up or have already had a device called an LVAD, or left ventricular assist device. Our standard therapies up front are usually just various types of medical therapies, ACE inhibitors, ARBs, beta blockers, Lasix. And then when patients are struggling on those medicines or aren't feeling good on those medicines, we sometimes consider therapies beyond them, whether that is specific device therapies for some patients, like defibrillators or biventricular devices to help the heartbeat in synchrony, or again moving beyond that, advanced therapies, things like special IV medicines called inotropes, or surgical therapies like transplants or LVADs. These are all things we consider for our patients.
And you are going to have a booth at the health fair?
Yes.
And what are you going to provide at that booth?
It's going to be some information about heart failure in general, a way for patients to kind of see a little more about what heart failure is and ways they can help manage heart failure at home if they do have it, focusing on things like exercise, sodium restriction, a little bit more information about their medical therapy, or any questions they might have about patients or family members with heart failure. Heart failure symptoms can be very vague, and it's not the fault of anyone. It's just the symptoms are not always conducive to say this is heart failure. But a lot of times what you'll see with patients is increasing fatigue, shortness of breath. They can have trouble laying flat. When they lay flat, they feel this sensation that they can't breathe. If you have heart failure or have concerns about heart failure, speak to your general doctor, speak to your cardiologist, see if it'd be appropriate for you to come see us here in clinic. I think the biggest things our patients can do are just making sure they're trying to stay active, follow their diets, which is challenging, but it's something that's vastly important. And when you have, a disease like heart failure, it's crucial that they do the best they can.
Yeah, the health fair next week, guys, it's free, and you can get one-on-one advice from the experts.